Legislature is working on its own budget proposal that's due by the end of April. After that, the governor and lawmakers will work to create a final budget, which is due before the session ends on June 4th. So how can they solve all of this? Rising costs of Medicare and Medicaid. Cities and towns say they're underfunded by $400 million collectively. When it comes to their education costs, there is a lot to balance when it comes to balancing a budget. Joining me now is the Republican leader in the House, Vincent Candelora. Good to see you, Mr. Candelora, once again. Let's start with the budgets of cities and towns. The Connecticut Conference of Municipalities, I know you know this, said cities and towns are collectively $400 million underfunded because of the rising education costs they face each year. Is that true in your estimation, and can it be fixed?
Yeah, I mean, the towns, what they're saying is you're not keeping up with inflation. So you're flat funding us, which is nice, but we have more and more costs that are impacting us. You know, we've heard the debate, special ed is over budgeted by $109 million. That is just the state share.
And that's 1 year, right? So it would be.
That's just 1 year,
yeah.
And it's the state share. Extrapolating it out, it could be up to $500 million that towns are paying. You know, you talk about the energy costs, those public benefit charges, the schools have to pay those charges too. So electric prices are through the roof. So they have their challenges, and they need the state's help because they can only raise property taxes.
So, and when you see the word raising property taxes, you get a quick clapback from voters, pretty much. So what do? What's the solution?
Yeah, I mean, the state has to prioritize its towns and cities. The property tax is so regressive because everyone has to pay it, and they're trying to put food on the table and maintain their homes. It gets to be crippling. And so our state needs to make sure there's a steady stream. When Republicans did our budget last year, you know, we fully funded special ed, knowing that we want to avoid those property tax increases.
So are we talking about adjustments in priorities? Are we just moving stuff on the balance sheet? Are you hinting at working with guardrails? How do we
Yeah,
fix
I mean,
it?
there has to be an adjustment to priorities. One of my frustrations is, you know, last year, Republicans, we did a budget. It was balanced. We knew we were going to have Medicaid overruns. We knew we were going to have special ed overruns. The governor and the Democrats ignored it. And so now, going into next year, we have a $500 million overrun in the budget this year alone. So that money, which could have been used for next year, is gone. It's going to be absorbed into this year. You know, on top of not knowing what the feds are going to be doing, is a lot of uncertainty and a lot of challenges that we're going to have.
So if there's a time to use the rainy day fund, when is it? Because it seems like we have this great rainy day fund and projected over $1 million for the next 3 years, but we're always reticent to touch a penny of it. So when is the good time?
Yeah, I mean, the rainy day fund is there for emergencies. Like even this year, it looks like with all the spending, they're going over the spending cap. The governor has tools in his toolbox. He could do rescissions. He could declare an emergency and go over the spending cap.
So rescission is when he says, look, we're not going to spend here. I'm going to claw that back.
That's right. And then you also, with the rainy day fund, that's there for the emergency. What we could do is let's look at immigrant health care. Right now, illegal immigrants, the health care that's being given by the state in Connecticut, it's Cadillac plan. It's been over budgeted. It's going to cost us over $100 million next year. That's something we could look at and say, let's par that down. Okay. Those are the decisions we need to make.
So special education costs, let's go back to that for a second, have been a big focus this year. Superintendents across the state have said it. Should that formula be adjusted? If, say, for example, Bridgeport has 2,000 special education students, should their cost be adjusted, their cost sharing, for the number of, and say Killingly maybe has one? Should it be adjusted in that respect?
Yeah, I mean, the state sort of does that because of the way our formula works. If you have more money you're spending, the state gives you more money. What's fallen down is we didn't fully fund it. So the state needs to fully fund its share of special education. That's the first thing. I think we have to look at, are we getting the right bang for our buck? Should we be capping some of these cost services that are provided by private organizations?
So looking at how much they charge for those services and put a cap on it. So let's talk about quickly Medicaid and Medicare. Governor Lamont's proposed budget puts it over the spending cap. He knew going in, I guess back in December, the comptroller said, look, the way things are trending, we're going to need more money for this area of the budget. How do we fix that? He realizes it needs to be fixed. What happened?
Yeah, I mean, the governor's budget ignored it, and so now it needs to be brought in. It's a $230 million that now needs to be absorbed. the governor's budget also assumes a hospital tax, which is expiring. He's got to negotiate that deal. That's another $300 million. So those are things that the governor's office really has got to negotiate, and it's going to have to be worked into the budget. It's going to be a daunting task.
Yeah, the hospital tax alone is going to be an argument, I would imagine.
It's a $900 million revenue source for the state. Yeah.
So that's got to be figured out.
Yeah.
All right, we got to leave it there. Representative Candelora, thank you for